Thank you, everybody, for joining us back here at Hemostemix's channel. We have a very special guest for you guys today as we sit here with the Chief Medical Officer of Hemostemix, Dr. Fraser C. Henderson. And Doctor, how has your 2023 kicked off for you so far this year?
It's been not too bad at all. Thanks very much, Michael.
Good, glad to hear it. And a lot of exciting things coming this year in all sorts of fields. But we're here to talk about ACP and NCP with you. So can you help us understand ACP1 and NCP1 from your perspective?
Yeah. These are both products of a cell developed by Hemostemix called the synergetic cell.
Mhm.
The synergetic cell is derived from a blood-drawn product and can differentiate into angiogenic cell precursors called ACP or nerve cell precursors called NCP or cardiomyocytes. And we have some very exciting new outcome analyses of treatment of patients with cardiomyopathy. And we also have some exciting work in progress for critical ischemia and some research for the nerve cell precursors, which we think will be a breakthrough for neuropathic pain and other disorders of the central nervous and peripheral nervous systems. So it's actually tremendously exciting.
Yeah, fair enough. And some of these, this retrospective heart study, the results are said to look very compelling. Can you help us understand these results in terms of mechanism of action for the autologous ACP1?
All right. So understand that people have been injecting stem cells into the heart for the last almost 20 years. And typically they take them from the bone marrow and then they inject them into the heart. And while some studies looked pretty good early on, when they began doing larger double-blinded studies, the results did not pan out. Now, ACP has distinct advantages over bone marrow-derived stem cells. Bone marrow is the source of a great number of cells, but when these cells are aggregated and then later transplanted into patients, many of them undergo immune rejection, and they tend, in general, to remain in the circulation. And for a few days, they can exert powerful endocrine, cytokine effects upon the injured heart. But after 4 days, most of the mesenchymal stem cell cells are gone. On the other hand, the ACP from Hemostemix is a cell line that is pre-programmed to develop into blood vessels and possibly cardiomyocytes, and pre-programmed to release a number of factors that not only stimulate the formation of new blood vessels and help damaged vessels to recover, but they also have a relatively unique ability to attract cells from the periphery to come in that participate in the recovery of the heart. In animal studies, the ACPs were found to migrate and implant into the damaged cardiac tissue to a high degree, more than we've seen with bone marrow-derived mesenchymal cells. So they have better migration potential, and they appear to have better potential in terms of decreasing the scarring that occurs with a cardiac ischemic injury. They repopulate the heart and they restore blood flow. And our results from the recent outcomes analysis that was performed by statisticians from Penn State show really exciting, promising results.
Yeah, wonderful. And speaking of there is this CLI interim analysis which shown that 83% of the patients this doctor followed for 4.3 years experienced healing of ulcers, cessation of pain, and saved limbs from amputation, which is obviously a humongous deal for a lot of people suffering with those conditions. But unfortunately, the power of the study was impacted with previous management. Can you walk us through what happened there, but like what the real key takeaways are?
Well, I mean, as you said, the vascular surgeons who were performing the study were very excited by the results
Mhm.
of the stem cells, although obviously they were blinded, but they had a sense that the patients seemed to be improving. And in fact, the results do show that there was uh, that ulcers were treated and went away, that the pain was improved, and that whereas many patients with critical limb ischemia lose their limbs over a 4-year period, extremely few of these patients who were treated had any kind of limb amputation.
Mhm.
The uh, unfortunately, halfway through the study, there was a change in management, and the numbers of patients enrolled in the study was cut in half. And that was not sufficient numbers to generate statistically significant results.
Mm, unfortunately.
However, the results were good enough that we believe that the Food and Drug Administration will approve the compassionate use of these cells commercially. So we hope to begin actually using these cells on a compassionate use for critical ischemia.
Perfect. And there was also the NCP is the subject of an animal study at Clemson. And like, what are they studying there? What are they diving into with NCP?
Okay, so the NCP is one of the derivatives of the synergetic cell,
Mhm.
and it's a cell that is committed, it's programmed to form a neuron or an oligodendrocyte, which is a cell that wraps the neuron with myelin to allow it to conduct,
Mhm.
or it can uh, develop into an astrocyte. An astrocyte is one of the supportive cells in the central nervous system. So, uh, in the Clemson study, they're using a rodent model with a spinal cord injury and infusing the cells into the spinal fluid. And they're looking at migration, at the ability to recover cells to prevent programmed cell death called apoptosis,
Mhm.
and to treat neuropathic pain. And that's the main focus, neuropathic pain and motor recovery. Many animal studies and even clinical studies have shown that stem cells can and do treat neuropathic pain. So we're very excited about this potential. And neuropathic pain is our first goal, to get a treatment for that problem that does not have any good treatments out in the market right now.
Yeah, fair enough. It is really promising, and anyone who is experiencing neuropathic pain can tell you it definitely affects your quality of life. So we're looking a lot for any sort of solutions to these. And speaking of like, you're a neurosurgeon, so and you practice in the area of syringomyelia, Chiari, cranial cervical instability. So how significant is the promise of NCP and NCP plus ACP for patients suffering from conditions like syringomyelia and other conditions of the central and peripheral nervous system?
It's actually very exciting. Uh, we're looking at syringomyelia, and syringomyelia is the formation of a fluid cyst inside the spinal cord in response to an injury,
Mhm.
or scoliosis, spinal cord injury, sometimes with a Chiari malformation or tethered cord. Things that damage the spinal cord can cause syringomyelia. And many of these patients have extremely severe pain. Uh, Bobby Jones, one of the greatest athletes in history, the golfer,
Mhm.
uh, died of syringomyelia. And so I'm involved in a society, the Bobby Jones Chiari Syringomyelia Foundation, which has within the foundation 80 or 90 neurosurgeons who are very committed to treatment of these disorders. And we see syringomyelia as one orphan disease population in which these cells will make a profound impact on treatment of the neuropathic pain and possibly even the sensory motor recovery that would go along with that. If successful, this gets us an FDA clearance then to treatment um, of a much broader scope of patients. For instance, 1/3 of spinal cord injury patients have a cyst in the spinal cord, and half of patients with spinal cord injuries have, significant severe pain. Patients with scoliosis, 30% of them have syringomyelia and pain. So the market there is enormous,
Yeah.
but that's really a stepping stone to the broader treatment of things like traumatic brain injury. And remember, there are 100,000 troops returning from the Middle East now with traumatic brain injury, for which there is no treatment. And I'm not even going to get into all of the other degenerative conditions that everyone is familiar with.
Yeah, fair enough. Well, listen, Dr. Henderson, thank you for letting me pick your brain here and getting your insight on a lot of these topics. I guess turning back to markets as a whole in 2023, which is kicking off pretty decent here. How do you feel about hemostemics for 2023? Like, what's your outlook?
Very optimistic. I see, the outcomes analysis of this cardiomyopathy data has been just far better than we ever anticipated. And remember, there are 5 million people in the United States alone with cardiomyopathy, for which there's no really good treatment. We may have an excellent treatment for that. There are also 7 million people in the United States with neuropathic pain, and we may have a good treatment for that. So the potential for helping people is enormous.
Glad to hear it. Well, doctor, thank you so much. It's always a pleasure to talk to you. If anyone has any questions for Dr. Henderson or anyone else, don't be afraid to send them over to us. For now, doctor, thanks again. Have a wonderful day.
Thanks very much, Michael.